Healthcare organizations continue to face workforce and skill set shortages, reducing their capacity to meet increasing demands for quality patient care. User-friendly, automated solutions can mitigate these issues. Patients can use these solutions to quickly receive guidance for both initial contact and follow-up care. Automations can also review patients' unique health conditions to align them with recommended medical guidelines. This demo shows an example of a patient-focused, intelligent guide that can help primary care centers engage with patients. The guide can use a patient's symptoms to find approved clinical protocols and advise them on next steps to consider. Generative AI powers the guide, which uses Amazon Bedrock and Anthropic's Claude large language model. Here, a patient in pain engages with the guide by answering a series of questions. The guide then asks about the pain's location, its severity, and its duration by using a programmed flow of questions. These questions are preset with the industry standard Schmidt-Thompson clinical protocol. Since this patient has been experiencing pain for more than 8 hours, the guide recommends that the patient schedule an appointment. Healthcare providers can automate this process by integrating a scheduling system within the guide. When the patient asks how to manage pain in the interim, the guide offers personalized recommendations. It also details over-the-counter medication options. The guide has built-in guardrails for clarity during patient interactions. When the patient asks if the guide is a doctor, it responds by clearly stating that it is not a clinician. It defines itself as an AI assistant that supports Triage to provide recommendations based on accepted clinical protocols. Additionally, the guide can respond to context-based questions. In this instance, the patient asks the guide if generics are better than brand-name prescriptions. The program understands that the relevant context is medications, so it responds with a guideline-driven response. It recommends medications specifically related to the patient's back pain condition. The guide also provides patients with additional important information, including a response explaining how it arrived at a recommendation. In this case, the clinical protocol suggests that the patient be evaluated by a doctor if the pain lasts more than 8 hours. Furthermore, the program can recognize positive and negative sentiments. Here, the patient is concerned that they may need surgery. The guide says that it understands their concern and recommends that they check with their doctor. A generative AI-powered patient guide does not replace face-to-face provider interactions with patients. However, it can augment your current workforce, especially in times of shortages. This can reduce clinical burdens so critical patients can be seen first. It can also help patients better understand symptom severity and manage symptoms appropriately. This can reduce unnecessary emergency room visits, lower healthcare costs, and increase both patient and clinician satisfaction.